if you're having surgery, you really are only losing about a centimetre to a centimetre and a half when they rejoin your urethra, because your bladder is going to move down into the void and they're going to stretch that back. The problem is if you're not doing the rehabilitation and you're not exercising your penis afterwards, your penis is just made of smooth muscle. And so all muscles, if we don't use them, shrink. So if you think of Arnie Schwarzenegger when he was, Mr. World or whatever, he had massive muscles. He would have been using those muscles all day, every day. Then he stopped and they shrunk. And so because in nature, a healthy penis is getting its exercise at night time when that person's asleep or he's using it all the time. So it's getting exercise and saying things that are arousing and it's going up and down. That's naturally keeping the penis healthy and the girth and the length. But then once you have either radiation or surgery and the time goes on where you're not exercising those muscles anymore, they're the same as all other muscles. They just lose size and shape. So, that they lose their length and their stretchability and they lose their fullness. So, yes, I think that is preventable. And I really have got to the point now where I'm encouraging men pre-treatment to do what a teenage boy has probably done and put a tape measure on their pubic bone and stretching their penis out placid and measuring it, writing it down and putting it somewhere, because I also think a lot of it is perception. So I think a year down the track, it's very easy to think it's like the fish that got away. It was this big when it was this big. So I think often I'll say to guys, did you do that when I asked over? Yeah, I did. But go back and measure it again and send me an email and tell me how much you've lost. And it'll be, actually, I only lost a centimetre. But it's this perception thing. And also because the void is bigger when the prostate is gone or has shrunken from radiation, then the penis is able to go back into the void. So it's about actually thinking about what's actually going on there. But they definitely do shrink without exercise, just like all muscles.
Is there a way of bringing that back? Because am I right in thinking then the shrinkage that occurs is two factors. The first is that urethra genuinely has become shorter, that there is the prostate being gone, has created a void, which actually is that then almost pulling the penis back. But then there's the second part, which is the lack of nocturnal erections means it's essentially not going for a jog every day. So then over time, there's over time a shrinkage occurring as well.
So some of it is just about the penis pulling his head back in like a turtle and hiding from you, And unfortunately, nobody's invented like a spacer. Wouldn't it be amazing if when they took the prostate out, they could put a prosthetic spacer in there so we can have that retraction issue? I actually don't know why no one has invented that, but it'd be amazing. So there is that issue, but when it's just that, because you can get the glands of the penis and stretch him out and he's back to normal, or when you have an injection or you use your pump, you go, oh, it's normal. But then what happens if it stays retracted all the time and you get that muscle wasting, then it can get what's called a buried penis, where it is permanently in there and you can't even pull him out enough to do a wee. So, I've seen men that have said, I don't need penile rehabilitation because I'm not sexually active. And then they suddenly have got terrible nappy rash because every time they urinate, it's going all over their testicles. So I think that some of it is just perception, and you know that because you can pull him out and he's normal. But then you get this permanent loss by going back. That said, even if you've done nothing at all for 2 or 3 years, I have seen a lot of men who have not got back to their full form of glory, and that might be because they thought it was bigger than he really was, but have said he's definitely gained girth and length again once I've started using a pump regularly.
Yes, that makes me think of the studies I've read showing it's usually 4 weeks. They do 4 weeks daily as a trial. And while there's small sample sizes, it at least seems that there's a significant difference of men who are finding some size has come back. And somebody did want to know, actually, in your experience where you've worked with men to put together a rehab program, or that they've done your online rehab program where you talk through this as well, once they've put that together and have done maybe over that 4-week mark, how many men do you see do regain size? Or are there some where they can do all the rehab under the sun, but the size is going to stay what was a bit less post-surgery?
I've never had anybody tell me they haven't seen an improvement. So if I think about actually one of the men that came to me through you, he had done nothing for 5 years. And I saw him last week on a Zoom consult, and he's been using the pump and a daily PDE-5 for the last 12 months. And he's like, my penis is so healthy again. He's pink. I've got my girth back. It is a bit shorter than it used to be, but it's 10 times better than it was a year ago, you know? And so he's absolutely ecstatic with that, you know? Like it just makes me feel happy to look down in the morning and go, he's still there, you know? And because he'd left it so long, he isn't getting full spontaneous erection again, but he's getting 50%. It's good enough for him and his partner to have intercourse, and it's a massive improvement on where they were a year ago.
And we're talking about the pump a lot as the main intervention to prevent shrinkage and also trying to bring it back. Are there any other interventions that you like to recommend alongside that for men to think about?
Definitely, I think, should take a PDE-5 if they can. So low-dose tadalafil or low-dose Cialis or Viagra. I think that personally, tadalafil is better because it just stays in your system for longer, so you've got better blood flow for longer than you have with Viagra. But some people can't tolerate tadalafil; they get aching in their muscles, and then we would change them to sildenafil, which is Viagra. So I think that is a definite adjunct. If I have men who really don't want to take pharmaceuticals, I will recommend 2 herbs, arginine and lacaritine, and also a bit of curcumin because it reduces inflammation and improves blood flow from a natural point of view. By all of those, I advise for Peyronie's as well. And I do also encourage penile massage. So I don't think penile massage is as effective as using a pump, but it's certainly better than nothing. Also exercise and pelvic floor muscles. Like, don't discount those things. You know, the more exercise you do, the more blood flow you get into your pelvis. Blood flow is the key to everything. Pelvic floor exercises, every time you do one of those, you're pumping fresh blood into your shaft of your penis and those muscles. There's some really good research out now about traction devices for length post-prostatectomy. So Restorix is probably the easiest to use, and you only need to use it half an hour morning and night. I actually have one surgeon who refers to me who prefers traction over pump. In my experience, using traction stops the loss of length, but it doesn't help with this girth. And that's where I think the pump is the game changer, because when you're stretching something out and holding it stretched for half an hour morning and night, yes, that's stopping that retraction, but it isn't helping the muscle build up and get meaty. So the guys who have chosen that because they see that as easier to just plug it on, they don't have the same effect with the girth. So I think if you've lost a lot of length because you've done nothing for years, I think using a traction to start breaking down some of that fibrosis is fantastic, game-changing. But you still need to use a pump because you also want to improve girth.
Very related, I had a man asking if he chose to stop using his pump, is it likely that his penis would, he actually says, shrink away?
It really depends on him personally. If he has had return of spontaneous erection and he is waking up in the night time and going, oh, I've got 50% engorgement, and he's doing his thing, or he's having a shower in the morning and he washes him and there's a bit of blood flow and he's getting 50%, then I'll often say to my guys, stop using the pump. You know, always use it for the first 2 years, but I'll say stop using it, but be mindful of what's going on down there. If you start going, nah, he's not out in front as much as he used to be, he looks paler in colour, he's not pink and healthy like he was, throw that to him. But if he still looks good in a couple of months' time, then that's okay. So, you know, I think you have to really judge, that's how you judge where your body's at with the healing process. And you know, you might even find that you get some nerve recovery and you get to a point where your penis is exercising himself again, and that might be great for 5 years. And then age catches up with those nerves and they stop doing it again, and they'll go, I've noticed a change. It's like, now get your pump back out and have it.
So if somebody listening to this is thinking, okay, I know that I have lost some length post-surgery, if they go through this rehabilitation, is it that it's likely they would get their whole size back as it was pre-surgery? Have you ever seen men who even get a little bit more? Is that possible?
I certainly have guys that say they've got bigger penises now. And I suppose that is possible because they may have had poor erectile function before the treatment and not done anything about it because they didn't know they could. And then they'd had the treatment, learnt all about this and started doing it. So they've actually resumed some of their previous health of those smooth muscles that they didn't have before because they'd lost function already.
That then makes me think also potentially they've decided to focus more on their general well-being. They're exercising more. Maybe they've lost some fat. And if they lose some of that fat pad, then of course that also will make the erections seem a lot bigger.
Well, there's an amazing statistic that is for every 16 kilos a man puts on in his lifetime, like overweight, he loses 1.5 centimeters of his penile length. Losing 16 kilos straight away gives him back 1.5 centimeters. So, that straight away is counteracting what you're going to lose in that surgical treatment. So, like, if there's ever a motivation for a man to lose weight, it's got to be that you get an extra 1.5 centimeters penis.
You think there'd be a public health campaign about it at this point? Yes. Thank you so much, Melissa. That was just jam-packed full of really important information when it comes to the change to penile size post-prostatectomy. And if people want to find out more about your work, I'm going to fill the description box below with lots and lots of links. In particular, I want everybody to go and check out Melissa's online penile rehabilitation program because it comes with a one-on-one consultation, which I think is game-changing the way Melissa has set this up. You basically get like almost 8 consultations with Melissa, or like the amount that it would take for her to get through that with you, all in video format. You can watch it in whatever speed you like. You can go over them again and again so that when you get round to having that consultation with Melissa herself, you already have so much background information. And so then she can just tailor and tweak and you can just get a bespoke rehab program for yourself.
That is exactly it. So normally it would take about 8 consults to talk to someone about all of that. And I think a lot of that consult time is wasted with repetitive stuff. And it's just great to be able to have people have that background information and then just concentrate on the nitty-gritty of their issue.